My name is Mackenzie Sweeterman, and I will be giving you an informational speech today on miscarriages. Since the beginning of time, women have been giving birth. The process of a pregnancy is full of an overwhelming feeling of happiness, be it unsurety. However, the darkest part of a pregnancy that not many women and their partners like to think about is the thought of a miscarriage, when in fact 10% of every pregnancies end in a miscarriage, with over 3 million cases per year. The miscarriages happen within the first trimester, with the most common cause in the first trimester being chromosomal abnormalities. But other causes can be an immune problem, hormonal problems. They can be, you can have an infection or infections within your body, and even a blood clotting disorder. But the most common causes are unknown causes. No one really knows what might have caused it. There are many different symptoms you can feel whenever you have a miscarriage. Many women have reported fluid, bleeding, and even tissue coming out of their vagina, pain in the lower back of the abdomen. They have even said that they have felt an overwhelming feeling of sadness, depression, or grief. You can feel, you can have nausea, vomiting, even you can even feel contractions like you're about to give birth. So, hypothetically speaking, you just had a miscarriage. You go to your doctor and you talk to them, and they give you 2 types of procedures, or 2 different treatments that you can do. One, which is dilation and courage, or D&C, and that is when you go in for a procedure with your doctor where they dilate your cervix, which they widen it, and then they take a instrument called a courage, which is basically like a little suction cup, and they suction all the tissue out of your uterus. And or with the recommendation of your doctor, you can get medication, which basically just helps you pass through with the tissue. But a lot of women don't know the risk factors, which is a very big thing. Many women are at risk if they are over the age of 35. If you drink heavily, you smoke, and obviously if you do harmful drugs. But one of the main things is if you have been diagnosed with lupus, polycystic ovarian syndrome, and even if you are obese. But one of the ones that I found that was the most uncommon is if you drink a lot of caffeine during your pregnancy, you are at risk for a miscarriage. But a lot of the facts that many women don't know is you still have pregnancy hormones within your blood after you miscarry 1 to 2 months after your miscarriage. But you get your regular menstrual cycle back 4 to 6 weeks. And though it is a very, very, very sad and dark thing that has happened to many women, with your recommendation of your doctor and talking with your partner, and if you're religious, with a lot of prayer, there you have a very high possibility to get pregnant again. I really hope you found a lot of information with this. I know I did whenever I researched it. Thank you for listening.
And how long is that? 4.7.